But for now, at least, the decision is likely to affect one group in particular. And it's not the group you might expect. The payments, known as cost-sharing reductions, or CSRS, reimburse insurers for special plans they offer to low-income consumers. Those payments, worth $7 billion this year alone, have been the subject of an ongoing legal dispute over whether the federal government has authority to spend that money. Because low-income consumers are the primary beneficiaries of the payments Trump just stopped, many politicians and pundits are saying it's low-income consumers who will have to pay more for their coverage. That's not correct. For the time being, the people who end up paying more will tend to be middle, or upper-middle-class consumers. That's because, by eliminating those insurance payments, Trump will trigger an increase in another form of financial subsidy that the Affordable Care Act created. And that leads to some counterintuitive results. Health insurers selling through one of the Affordable Care Act's exchanges, whether it's or one of the state exchanges like Covered California, offer plans in 4 different tiers: bronze, silver, gold, and platinum. Bronze is the least generous. It's basically a catastrophic plan where, except for 3 routine doctor visits per year, beneficiaries pay every medical bill until they hit a high deductible. Platinum plans look like a really generous employer plan, with low co-pays and deductibles. These insurers sell other plans, too, among them, a special set of silver plans that come with lower deductibles and co-payments. These are available only to people with incomes below 250% of the poverty line, or $61,500 for a family of 4. The Affordable Care Act requires insurers to offer these plans, which are more expensive to provide because they cover more. The CSR funds are supposed to reimburse the carriers for that extra cost. And here's the truly bizarre part: people who qualify for the premium tax credits can use those tax credits to buy any plan they want. With much bigger tax credits, some of them will discover that a more generous gold plan costs less than they would pay for a less generous silver plan. Regardless, Trump's decision has gotten their attention, and not in a good way. It's the clearest signal yet that he has zero interest in making the newly reformed insurance markets work, and that, as former White House advisor Steve Bannon admitted over the weekend, Trump is actively trying to blow up the markets. Providing insurance through the Affordable Care Act has not been an easy endeavor. Healthy people aren't enrolling in the numbers everybody had hoped, making it difficult to balance the books. Officials in many states have been uncooperative or downright hostile. And, at the behest of congressional Republicans, the federal government failed to make another set of payments that insurers were supposed to get. A critical mass of insurers has remained in the program because, as of this year, their financials were finally improving and they could see the makings of the stable, profitable market that the law's architects always envisioned. But that future was dependent on an administration that wanted the program to succeed. The Trump administration feels differently, and insurers will be thinking about that hard in the spring when they make their decisions about whether to stay in the program for 2019 and beyond.